So assisting on your endo procedure, so we're gonna follow along with this right here, okay? So you'll be responsible for assisting in the root canal. Some of the tasks that you've been practicing, like placing the cavit, drying the canals, irrigating, what was the other one? Filling the irrigation syringe, those will be part of the procedure now. Setting the files.
I'm still not clear on how to set the files.
You move the stopper and you measure it.
Oh, is that what you, I thought you meant like organizing them on the sponge.
By color, so that while you ran blue, grab black.
Because you don't know what you're gonna need till you get in there, right?
Yeah.
Oh, so you need,
Yeah.
okay.
And then once you figure it out, you're gonna put it in the other one.
Alright, so this sponge right here is a sample from one of the endodontic practices. So we have right on here, do not open, because this one we want to stay untouched, okay? So this is set up, it says 19 on there, and it has an H meaning Hoyle, that's a doctor that likes to use that one. But that means that all of these files are set already to 19 millimeters, okay? So this is how this particular office sets it up, but it is a pretty common setup. So you can see it goes 10, 15, 20, 25, 30, 35, 40, 45. So it would be pink, gray, purple, and then white, right? White, yellow, red, blue, green, black. And then it's gonna restart. White, yellow, what?
Yellow.
Red, blue, green, black. Okay? You have your reamers on one side, you have your K files on the other. Okay? In the middle, they have their 6, 8, and 10s, and then they have a bar brooch. Okay? So this should stay unopened, but this is a sample of how they set it up at that particular office. So that's pretty much what we're emulating here. So they should be in color order and in numerical order. Okay? And then the brooches are in the middle. So, we have our patient in. As Mrs. Santos says, you do not pull your barriers down until the patient is seated. We had our initial burrs already loaded. We're going to start by doing a diagnostic test. So the first thing we would do would be to take an x-ray. We would take an x-ray of the area to see what that tooth looks like. Okay, our pre-op x-ray, and I'll go forward and just show you our x-ray. That's our pre-op initial radiograph, so we can see that there's a lesion. So that gives us some idea of what we expect these symptoms to be. Okay, so we're going to start with the percussion test. Now remember, the tooth in question here is tooth number 30, okay, which means my control tooth is going to be which tooth? 19, okay? So everything I'm going to do, I'm going to start on tooth number 19 and then go over to the lower right-hand side. They will usually check the tooth in question and then 1 or 2 teeth on either, like the adjacent teeth as well. What's the first thing I'm going to ask the patient?
What his symptoms are?
Right, so what the chief complaint, right, CC, what the chief complaint is, okay? So I'm going to start now and I'm going to tap on each of the 4 cusps, and I'm going to ask the patient to raise their left hand if he feels anything uncomfortable, because we don't want him to raise his right because we have instruments over the right, okay? And I'm going to tell him that this is what normal tapping feels like, because that's the control tooth, okay? Now I'm going to let him know that I'm going to come over to the side where you are having some discomfort, having some problems, and I'm going to start on the adjacent tooth. And again, just going to tell him to raise his left hand if he feels any discomfort. And then he raised his left hand, that's uncomfortable when I'm tapping there. Because we saw that lesion, it's going to be uncomfortable when we're aggravating that, putting pressure on the periodontal ligament. Okay? So he's uncomfortable to that tapping that's built up there. So we're going to make a note that he was positive for percussion on tooth number 30. Okay? The next thing we're going to do is palpation, so I'm going to do that, right? I'm going to feel with my finger around the apices, and I'm going to tell him that's what normal feels like, and then I'm going to come over to the affected quadrant. And, he's going to be a little uncomfortable now, and I'm pushing around the roots of number 30 because we can see that lesion. Okay? So we're going to put that he was positive for palpation. Now we're going to start with our cold test. So we have our endo ice, we have a cotton pellet on the locking pliers. We're going to spray it away from the patient. Thank you. I'm going to tell the patient that we're going to go on the buckle, right? So this is what normal cold feels like. Let me know when it goes away, and he says it's gone. And I'll say that's normal. It's normal sometimes to feel the cold kind of intensely. In a normal pulp, it should go right away. And he says, yes, it's gone. Okay? So we're gonna spray again, and I'm gonna check the adjacent tooth. And he feels that, and it's gone away. I'm gonna check the tooth behind. He feels that, and it's gone away. And I'm gonna say, let me know when you feel the cold. Let me know when you feel the cold. And he doesn't feel the cold. Why doesn't he feel the cold?
Because the tooth is necrotic.
Because the tooth is necrotic. We saw that periapical lesion. Okay, so he felt no cold there. So we'll give that back. So now we're going to do our heat test. The heat test is the least conclusive, I'll say, of all the tests. Okay, remember they can heat a piece of gutta percha, or we can just heat the glick itself. And I'll tell him this is what normal feels like. And he said yes, that he felt that. I'll check the adjacent tooth, he felt that, he felt that. Now the affected tooth. And he's quiet, he doesn't feel that either. Tooth is necrotic, okay? So the last one that we're gonna do is that electric pulp test. Now, we need toothpaste for that one, why?
So you don't wanna put it directly on the enamel?
No, we need it to complete, to help to make that connection,
Oh, yeah.
okay? So it's a conductor for us. So we'll do that on a normal tooth first, and you can, Mrs. Santos now is acting like the patient, so remember that we need a way to complete the circuit, so she's doing that by holding on to it, okay? They can barrier this, and we would just have the patient hold underneath the barrier. So we're gonna tell the patient, we're gonna go on the buccal. Remember, you would never put this on a metallic restoration, right? So we're gonna go right on the buccal surface. I feel like I could feel it.
I know, I'm letting go, I don't wanna feel it.
I know. So she'll dial all the way up to 10, and the patient will raise their hand when they feel it, so he felt that at 5, so they'll say that that's normal. Now we're gonna do the same thing coming over here. So she'll dial all the way back to 0 again, and then she's gonna dial up. He let go, he felt it. We'll go to the tooth behind. He let go, he felt it. And then we're gonna go to the tooth in question. And we're all the way up to number 10. He does not feel that. The tooth is necrotic. Okay? So we have our diagnosis now that the tooth is necrotic. So you want to make sure that you wipe the toothpaste off of this. Make sure it's clean. This can be disinfected. Actually turned off and disinfected. And this part can be bagged and sterilized. Okay, so the part that had direct contact with the tooth. So they'll usually have an area set up on the counter where they'll put that stuff off to the side. Okay? So now, we look at that radiograph again. We know that we are doing a root canal